Hi friends, Dr. Anurag Jaiswal once again. I am back, and this time there are basically two differences in what I am representing myself is. Number one, I am sitting in my mom's room today instead of sitting in my dining room, which I was in last two videos. And secondly, I'm slightly better rest today because there is a special reason behind it. Because one of my aunts, she called me and she just instructed me to wear something formal, and he said that Anurag, you are a doc and you should look like a doc and see that you don't come out in videos wearing a waist. Come on, don't do that, it doesn't look good. So try and be formal when you are representing yourself. The reason why I accepted her instruction, much of an instruction, is because that comment was purely out of love, because it was pure representation of her feelings for me. Because she is not a medical personnel, and the comment she made was purely out of the feelings she has for me. Because whatever I talked about in the videos, in my previous two videos, means absolutely nothing for her. She won't understand absolutely anything, a single word out of it. But the only thing she saw in the video was me, and she wanted me to look better, and that's the reason why I've decided to wear a shirt and a tie, and I promise you I'm wearing formal trousers too, though it is not coming into the video. Now, keeping the stuff aside, let us begin with today's topic. Today I want to discuss what is we call as the pain pathway. Once again, a very important subject for the physical therapist or the practitioners of physical therapeutics, doctors of my type or my category. Without further deviating from the subject, let me come into the subject directly. Pain pathway is the process or the pathway through which pain travels to our brain and is perceived by my brain. Now, pain is an unpleasant sensation. Now, we cannot deny that it's a sensation. It is definitely a sensation, but it is not the kind of sensation you would love to have. However, as a medical personnel, I can assure you, pain and bleeding, I underline the terms, pain and bleeding are the gift of nature, because that are the things which tells you that something is wrong with you and you need to go to a doctor. Or else if you don't get pain and if you don't get bleeding, you might not be able to realize that something bad is happening inside. I mean, there are times you must have heard of cases where a person is discovered in the morning already dead on the bed, and such cases are commonly observed among old people. And this happens because if you do an autopsy of such patients, you will come to know, or such dead bodies, you will come to know that actually it was an heart attack. So why is it that they couldn't complain, or whether they didn't try? The actual reason behind it is, normally patients of that age are diabetic. They don't have a very good perception of pain. Diabetic people have a compromised sensation, hence they don't sense the pain properly, and by the time they sense the pain, the myocardial infarction or the heart attack is already at its last levels, and they have no other choice but to die, unfortunately. And hence you understand that pain is very important to let you know that something bad is happening inside you. So let us begin with the pain pathway. So the pain pathway begins, this is a small piece of, you see, much of an artwork being done by me, and this I am going to use to explain you the pain pathway. It begins with the help of two nerve fibers. If you can see, I'll come a bit close. These are the A delta and the C fibers. Now, A delta fibers are fast conducting fibers and C fibers are slow conducting fibers. Now, why are they fast and slow conducting? See, there is a general rule in the nerve conduction velocity of the nerves. I repeat myself, there is a general rule in the nerve conduction velocity of the nerves. The rule is, you see, I have represented the rule also here symbolically. Yep, there you go. You see, the thin fibers are slower than the thick fibers. The thick fibers are slower than the myelinated fibers, and the myelinated fibers are slower than the thick myelinated fibers. Now, out of this, if you observe the C fibers, they are thin fibers, hence they are the slowest fibers, and hence they conduct impulses of pain very slowly. On the other hand, the A delta fibers, these are also thin fibers but are myelinated. Hence they come somewhere there in the series, and hence they are comparatively faster than this fiber. So A delta fibers are faster than the C fibers. There is another particular difference between these two fibers. That is, the C fibers are responsible for conducting pain from muscles, ligaments and deeper tissues, whereas the A delta fibers, on the other hand, are responsible for conducting pain from superficial tissues or skin. Now, how the entire process is carried out? As soon as a pain sensation is developed, there we go. Suppose this is the nerve fiber which has experienced pain, and hence it will carry the pain to the spinal cord. Where exactly of the spinal cord they will go to? They will go to the posterior part of the spinal cord. Now there is a general rule of spinal cord division. If you see this particular diagram represents the general rule of spinal cord division. The posterior part of the spinal cord is mostly sensory, and the anterior part of the spinal cord is mostly motor. Now there are exceptional areas in these two parts of the spinal cord, but general rule is this part has to do with sensations and this part has to do with the motor activity. Now pain being a sensation, pain is almost a sensation. It is a sensation, in fact. It's carried to the posterior aspect of the spinal cord as per the general rule, because the posterior part of the spinal cord has to do with the sensation. Now once it reaches the spinal cord, it meets a special area, a jelly-like tissue, and because it's a jelly-like tissue, the substance of this particular area, because it is jelly-like, it is called as substantia gelatinosa. The term gelatinosa simply signifies that the tissues which are present here are having a jelly-like texture. Now, once these fibers carry the pain impulse here, they meet a substance which is jelly-like and is called as substantia gelatinosa, which is responsible for blocking the pain. Now, because pain is not a very pleasant sensation, body always tries to reduce it by its own capacity. Similar function is carried out by substantia gelatinosa. It tries to stop the transmission of pain. Now comes the question, if it stops the pain, then why do we experience the pain? That's a good question, but it comes from me. It should come from you also. Now, the answer to the question is, the pain fibers are slightly more clever than substantia gelatinosa, which is responsible for inhibiting the transmission of pain. So what do the pain fibers do? They send a collateral fiber, a collateral branch which goes to the substantia gelatinosa before the pain fibers. It goes to the substantia gelatinosa before the pain fibers, and they inactivate the substantia gelatinosa. That is, the ability of the substantia gelatinosa to stop pain is blocked by this collateral, and hence the pain is transmitted from this area. Do you get my point? The collaterals which are given by the pain fibers reach the substantia gelatinosa before the pain fibers and inactivates the substantia gelatinosa, so that the pain can be easily transmitted to the second order neurons, also called as T cells. Now T cells, the term T means transmission. As they are helping in transmission of pain, so the cells are called as T cells. Do not take out any other meaning of T. T only means transmission here. So there we go. So the pain fibers conduct the pain by the help of the collateral inhibition of substantia gelatinosa to the second order neuron. The second order neuron is this particular neuron, the neuron which is going up. This particular neuron is called as the second order neuron, which has a special name also known as T cells. Now this particular track, this particular pathway which takes the pain to the thalamus, once again I'll tell you, the pathway which takes the pain to the thalamus is called as the lateral spinothalamic tract. Now the meaning of lateral spinothalamic tract. Lateral means the position of the fibers, for which it is known as lateral. Spinothalamic, as it is starting from the spinal cord and ending into thalamus, hence it is called as spinothalamic. If the fibers would have started from the spinal cord and would have ended in the brain, it would have been called as spinoencephalic, because it's starting from the spinal cord and it's going to the encephalon or the brain. But in this particular case, the fibers are starting from the spinal cord and is moving to the thalamus, and hence it is called as spinothalamic tract. Once again, spinothalamic tract. Now, as the fibers reach the spinothalamic tract and they reach the area called as thalamus. Have you ever wondered the meaning of the word thalamus? Thalamus means bag of nucleus, and if you follow my previous tutorials, nucleus is a group of neurons functioning together in the brain. Hence thalamus is nothing but it is a group of neurons which are functioning together or functioning similarly. In other words, thalamus means bag of nucleus. That's simple. That is very simple. So as that reaches the thalamus sends the impulse to the somatosensory cortex. Somatosensory cortex is the part of your cerebral cortex. It is present in a particular area. I'll be talking about the areas of brain in some of my tutorials. At the moment, simply understand that the pain is transmitted from the thalamus to the somatosensory cortex, and only when this impulse of pain reaches this area of the brain, you perceive the pain. If at any given point of the pathway the pain is blocked and it fails to reach this area, the pain will not be perceived even if the pain is present. So that completes your pain pathway. It begins from a pain carrying nerve fibers and it ends in the brain, also called as the somatosensory cortex. So I am done with my explanation of pain pathway. I hope you have understood, and I hope I am looking a slightly bit more formal this time, and people won't have complained in the way I look when I am giving ideas or you know, whatever knowledge I have and I'm sharing it. So from next time in my tutorials, I'll be very sure that I properly dress, and those who have felt bad, I am sorry. Thank you.